I was shopping probably 6 months ago in Costco, and there was this woman, this young woman, my goodness. She was working at Costco with crutches. So I said, "What's wrong, honey?" "Oh," she said, "my knee is so bad." I said, "I know a good doctor." I gave her Dr. Ballard's name. I said, "Listen, you cannot go wrong." See, Dr. Ballard is my number one. Dr. Ballard has fixed many things for me. I am bionic when I go through the airport, that's for certain. First surgery was my left hip, then it was my right knee, and then it was my left knee. I'm 81 years old and I wanted to be better. I didn't want to be worse. And it really has helped me, you know. I wanted improvement in my ability to live a productive life for the rest of the time that I had. I was limited. I was sitting more than I was working. It hurt to stand, it hurt to walk. My daughter is an occupational therapist. We talked a little bit about it. I said, "Honey, do you know of anybody that's really good?" And she says, "Oh yes, Dr. Ballard, because he's one of the best in the city." So that's how I went to him. I was very, very glad to get him. He was definitely interested in me. He's very kind. He's just very devoted to the comfort and the safety of his patients. I thought, I want him. He can do it. I trust him. Being a nurse, graduated in 1962, you have to understand that my medical knowledge was kind of old, kind of ancient. Well, then when I had trouble with my left knee, Dr. Ballard says, "Oh, we've got this surgical center. You're going to have it outpatient." And I thought, what? Outpatient surgery on an 80-year-old woman? The office said, "Well, you know, Medicare covers outpatient surgery." And I thought, come on now. I can't tell you how happy I was and how wonderful it was to have that surgery in the Oregon Surgical Institute as an outpatient. They took me as priority. I went in, and about 4 hours later, I left. I mean, it was just amazing. I was up and walking to the bathroom within an hour and a half after I had surgery. I wasn't laying in bed for 24 hours, 36 hours after having surgery. My healing was much faster than having been in the hospital just because I was up and active. I recuperated great. The physical therapy I had following it was very beneficial, very beneficial. It was hard work, but it was good. It was very good. During the recovery, dealing with Dr. Ballard was wonderful. I mean, I was doing well. I didn't need him. I didn't need follow-up, you know, and he was as close as the telephone. I knew that I could call his staff in the office and they would answer questions, but I didn't need it. You know, it comes from his heart and his soul that he knows what he's doing, and that just makes it so easy. It makes it so easy. He has a sense of humor, very personal, but a professional. And that's hard to get sometimes. It means a lot to have that type of person, your doctor that does the surgeries. Prior to the time that I had the surgeries, I was very limited because of the pain in my knees. I mean, it was hard for me to even go shopping. Couldn't stand in one position, you know, and I was limited what I could do outdoors. But now I have no limitations. You know, all of the flowers you see in my garden, I've done it all. I move pots, flower pots, I do everything. It's such a wonderful pastime to be able to be out and be on my own and to be pain-free. And thinking back over the surgeries, I had no regrets whatsoever. Because if I can do it at 80, anyone can do it.